the Surgeon General has issued a warning about alcohol consumption and the risk of cancer, calling for an updated label on all alcoholic beverages. Now, many Americans are not aware that any amount of alcohol consumption increases the risk of cancer, and alcohol is a leading preventable cause of cancer, responsible for about 100,000 cases and about 20,000 deaths annually in the United States. So the take-home message here is that there is no benefit to drinking alcohol, and there may actually be harm. So the recommendation is to abstain or minimize alcohol consumption as much as possible, especially for someone who's had cancer or you're high risk for cancer. Next, cases of Neurovirus, which causes a viral gastroenteritis or stomach bug, are on the rise across the country and especially here in Colorado. The virus is responsible for foodborne illness and is spread by fecal-oral spread, such as when someone who doesn't wash their hands after using the bathroom then prepares your food. And it's believed that the dramatic increase in cases may be a result of poor hand hygiene habits following the pandemic and possibly even a new strain of the virus, according to the CDC. Now remember that hand sanitizer is not effective against this virus, so remember to wash those hands with soap and warm water for at least 20 seconds to reduce the risk of transmission and to keep yourself protected. And finally, good news for coffee drinkers. A new study of more than 40,000 adults published in the European Heart Journal found that drinking coffee before noon is associated with a 31% lower risk of heart disease death compared to those that drank coffee all day long. Now, the proposed mechanism for this benefit is a bit unclear, but it's thought that the anti-inflammatory effects of coffee could be more profound when that caffeine consumption is concentrated at the start of the day, and it's less likely to interfere with your melatonin production or disrupt your body's internal circadian rhythm, the body clock, if it's consumed in the morning and not in the afternoon. I'm Dr. Payal Kohli with this week's Health Headlines.